Marianne, over to you.
Hello, everyone. I'm Marian Tabi, and welcome to the WHO Africa Media Briefing, which will focus on the just declared Ebola virus disease outbreak in the DRC. Before we start, here are some housekeeping matters. You can choose the language you would like to listen to this press conference, either in French or English, by turning to the globe icon on the bottom right of the screen and selecting your preferred language. Bonjour, je suis Marianne Tabi et bienvenue à la conférence de presse de l'OMS pour l'Afrique qui sera consacrée à l'épidémie des maladies à virus Ebola que le RDC vient juste de déclarer. La conférence de presse va se dérouler en anglais, mais vous pouvez choisir d'écouter la conférence de presse en français en cliquant sur l'igloo du globe en bas de l'écran et en sélectionnant la langue de votre choix. Now, let's introduce our panelists. We do have Dr. Jean-Baptiste Nikema, the WHO Deputy Representative in the DRC. Also on board is Dr. Patrick Otim. Dr. Otim is the Program Area Manager at the WHO Regional Office for Africa with Emergency Response. We also have Dr. Julian Anoko, the team lead for risk communication and community engagement at the WHO Regional Office for Africa. Dear panelists, you are all welcome. We will start with you, Dr. Nikema. Please, can you tell us a brief situation on the just declared outbreak and kindly tell us what is being done to respond to this situation? Dr. Nikema, over to you. Dr. Nikema, are you there?
Oui, désolé. Merci beaucoup et bonsoir à tout le monde. Donc, la situation, elle est la suivante. Le ministre de la Santé de la République démocratique du Congo vient de déclarer une épidémie d'Ebola à virus Ebola Zaïre. Donc, le germe est connu, l'épidémie est maintenant déclarée et la réponse est déjà en marche. Alors, au jour d'aujourd'hui, sur le terrain, il y a 28 cas suspects et nous avons 15 décès déjà, soit, soit une mortalité de 53,6%, ce qui est énorme. Alors, parmi les décès, nous avons du personnel de santé qui a essayé de sauver les malades, particulièrement le cas index, et ce personnel de soigner 4 personnes ont déjà perdu la vie. Alors, ce que l'OMS fait avec les partenaires et le ministère de la Santé, c'est d'abord de déployer rapidement une équipe de réponse avancée sur le terrain. L'équipe est déjà arrivée sur le terrain et va appuyer les capacités locales, les renforcer pour d'abord la surveillance, le suivi des contacts, la prise en charge des cas, la prévention et le contrôle des infections. Et ces éléments vont permettre de contenir l'épidémie et l'éteindre le plus rapidement possible. Comme nous connaissons la souche, l'avantage que nous avons dans cette épidémie, c'est qu'il y a un vaccin et il y a un médicament. Cela met le pays dans une position de force en termes de mesures, de contre-mesures pour renforcer davantage la riposte contre cette maladie. Alors, l'OMS, avec le ministère de la Santé, sera en première ligne pour cette réponse et va amener les outils nécessaires pour la réponse. Juste pour préciser également qu'un laboratoire mobile permettant de diagnostiquer Ebola est également déployé sur le terrain pour rapprocher le diagnostic de l'épicentre. Voilà ce qui est mis en place pour contenir cette épidémie. Merci.
Merci beaucoup, Dr. Dikema. Now, let's turn over to you, Dr. Patrick. Dr. Otim, can you tell us about WHO overall response? What is being put in place to quickly scale up the outbreak control measures? Over to you, Dr. Otim.
Thank you very much, Marianne. Good afternoon, colleagues and members of the press. Thank you for joining us today. We appreciate this opportunity to update you on the Ebola virus disease outbreak in the Democratic Republic of Congo, the situation on the ground as stated by the WR, the response being initiated, and the next steps to protect the communities. First, I want to sincerely thank the government of the Democratic Republic of Congo for acting quickly in confirming and declaring the outbreak. I also thank our partners for their collaboration, which has allowed us to rapidly mobilize expertise and resources in support of the national response. As was mentioned, as of September 4th, we have a total of 28 suspected cases, including 15 deaths in 2 health zones in the Kasai Province. Patients presented with symptoms including fever, vomiting, diarrhea, and hemorrhage. The laboratory tests conducted at the National Institute of Biomedical Research in Kinshasa has confirmed this outbreak as being caused by the Ebola virus species, and the government has officially declared the outbreak. Among the 15 deaths, unfortunately, 4 were healthcare workers, including a nurse from the maternity ward and a laboratory technician. At present, there are 6 patients hospitalized with similar symptoms, and efforts are underway to scale up response operation. An advanced team from the National Rapid Response, WHO, and partners is already in Kasai Province and is in the 2 affected health zones of Bulape and Mweka to help in the response. Immediate priorities are to strengthen disease surveillance, contact tracing, infection prevention and control in the health facilities and the communities. We are also working to establish a field laboratory, improve the clinical care, support safe and dignified burials, and ensure we engage the communities to raise awareness and encourage early reporting. Fortunately, as the WR has mentioned, there are approved vaccines and therapeutics for Ebola Zaire species. So based on the previous outbreaks and with support from the International Coordinating Group, ICG, that stockpiles essential vaccines, we supported the country to pre-position 2,000 doses of the Ervibo vaccine, which will be rapidly deployed to Kasai to vaccinate contacts of confirmed cases and frontline workers. The DRC is in the process of also requesting additional vaccine doses. In terms of therapeutics, we have 100 treatment courses of the monoclonal antibody against the Ebola species, which will be used to support management of the cases. However, the early initiation of clinical care, that is the supportive care, is life-saving, and it increases the chances of survival greatly. These measures are critical to help protect communities and the healthcare workers. So in support of the ongoing response, WHO is delivering 2 tons of essential supplies, including personal protective equipment, laboratory supplies, and medical sundry, which are necessary in managing this outbreak, and additional shipment will be deployed in the coming days. The Democratic Republic of Congo has experience of 15 outbreaks. This is the 16th one, and they have built extensive capacity and expertise in health emergency response. The last 2 outbreaks in 2022 were contained within 3 days. So our priorities in the coming days are to strengthen surveillance and active case finding in Kasai, and particularly the priority health zones and surrounding province, to ensure that we have strict infection prevention and control measures in all the health facilities in the affected health zones, provide medical and logistical support, including PPE for protecting healthcare workers, and then diagnostics for faster testing. reinforce risk communication and community engagement to counter misinformation and build trust, which is very, very important at this phase of the response. This outbreak is really a reminder of the ongoing vulnerability of communities across Africa to emerging and re-emerging infectious diseases. It reinforces the importance of strong preparedness systems, rapid detection, and coordinated response to save lives. We will continue to provide regular updates as more information becomes available, and we count on your support, dear colleagues in the media, in ensuring that we have accurate information that reaches the public. Together, with solidarity and quick action, we will contain this outbreak and safeguard the health of communities in Kasai, the surrounding provinces, and beyond. Thank you.
Thank you, Dr. Otim, for those details. We will now move over to you, Dr. Anoko. Could you tell us about the importance of collaborating with communities and also in ensuring public awareness raising on the risk? To you, Dr. Anoko. You are muted if you're talking.
Thank you very much. Good afternoon, dear colleagues. Good afternoon, dear partners from the media. Thank you for coming to attend this press conference. Ebola virus disease outbreaks present really unique challenges that extend beyond medical care. To control effectively the outbreak, we require community trust, we require community ownership, and active community engagement. Trust and cooperation means that the community engagement will build credibility for health authorities and enable cooperation with outbreak measures. We are going to work on strengthening risk awareness, public education that will help us and to give people accurate information for them to understand the transmission of Ebola and adopt protective measures and protective behavior such as safe caregiving and hygiene practices. We will also want to really reinforce the acceptance of intervention. Community engagement is key. For that, we are going to engage all the local leadership involving community, religious leaders, traditional leaders in awareness campaign. For that, for this engagement, we are going to support to develop culturally sensitive messaging that respect traditions while promoting safe practices. Dr. Otim has talked about the importance of addressing and managing misinformation and rumors. This is really key. So what we are going to do together with partners under the leadership of the government of the DRC to engage communities to help counter rumors and myths that can undermine outbreak response. We will also try to see how to really reinforce the fight against the reduction of the stigma to make sure that people who have been affected, who are suffering, are not stigmatized in their community. So I think that these are some insights regarding community engagement of its importance, and so as the public awareness, which is also important when for this outbreak, and using the two-way communication system. As Dr. Patrick said, DRC has a lot of experience. Our role will be just to reinforce and raise this as fast as possible at this early stage to make sure that communities are engaged, they are supported to really contribute to stop the chain of the transmission. Thank you very much, dear colleagues and partners from the media. Over to you, Mrs. Sabi Marian. Thank you.
Thank you, Dr. Anoko. Thank you to all our panelists for this overview. Now that we've heard from all our speakers, we will now open the floor to you, journalists, to ask your questions. We would like to just remind you that this is a media briefing. We ask all the people in attendance to bear with us as only journalists' questions will be answered. Dear colleagues of the press, please use the Q&A function on the Zoom application to ask your questions. Remember, you will need a name and the news organization you represent to have your questions answered. We will also take into account that if you ask a question live, please raise your hand, and also you need to take the time to introduce yourself and your media outlets in the Q&A function in the Zoom to be given the floor. I will now move over to, we have a question. I don't know if we have like a live question, but please, journalists who want to ask a live question, please be reminded that you can use the function while introducing yourself in the Q&A function. So I will ask a question to you, WR Deputy WR in the DRC. What capacities in terms of vaccine do we have to respond effectively to the outbreak? I'll start with you, Dr. Nikima, then you can complement Dr. Patrick. Dr. Nikima.
Oui, merci beaucoup. Le docteur Patrick a déjà donné les quantités de vaccins que nous avons aujourd'hui. Pour Ebola Zaïre, nous avons 2000 doses disponibles. Et ces 2000 doses, il y a les produits, mais il y a aussi les ressources humaines qui sont déjà bien formées pour administrer ces vaccins et faire rapidement en sorte que sur le terrain, la tendance soit renversée. Et je voudrais préciser également que nous essayons d'éviter la trop grande verticalisation. Nous mettons l'accent sur la continuité des services. Donc, dans ces zones-là, les enfants sous-vaccinés, les personnes sous-vaccinées, etc., le rattrapage viendra avec la continuité des services. Donc, nous ne faisons pas seulement une réponse verticale avec les vaccins. Bien entendu, ça c'est une priorité, mais nous comblons les autres gaps en termes de vaccination sur le terrain. C'est cette précision que je voudrais apporter et elle est très importante dans la réponse actuelle. Merci.
Merci, Dr. Nikema. Dr. Patrick, do you want to comment on the capacities in terms of vaccine? Please unmute.
Thank you. So vaccines, one of the, particularly when we talk about Ebola Zaire, the vaccines that we have are one of the essential tools that we use to help us stop the outbreak. And as the Deputy WR has mentioned, we really use this in an integrated approach, focusing on ensuring that this response does not interrupt the delivery of essential services. And we have seen in previous outbreaks that when this is not done appropriately using a systems approach, then other services and continuity of services will be interrupted. And of course, some of it is also because people fear to come to the facility. So we will have to do this in a way that addresses the risks of transmission, but also ensures that service delivery is maintained. Now, in terms of deploying the vaccines and the capacities that are there, so DRC actually, in the last two outbreaks in 2002, this vaccine has been deployed. So we have sufficient cold chain capacity that can be used to deploy this vaccine at the field level, and also the trained human resources that can be used, that will be used to administer this vaccine. And it's a critical tool that has helped stop the previous outbreaks in a very short time. So within the next 72 hours, the priority is ensuring that we have the vaccines on ground, we have the necessary cold chain and supplies that's needed to deploy them, and then the trained healthcare workers that will be used to deliver the vaccines. With this, we are quite sure that we can be able to have the targeted population. And this is only focusing on two categories of people. So we have the contacts of cases, of confirmed cases. So it's not, vaccination is not for everybody. The contacts of confirmed cases and their contacts, as well as the frontline emergency response teams, the healthcare workers and critical people, drivers of ambulances, those who are really involved in the response, those are the ones that will be targeted. So it's not a mass vaccination for the entire population, but focusing on the contacts of contacts, and the frontline healthcare workers. Thank you.
Thank you, Dr. Otim. I will still move back to you, but starting with Dr. Nikima for this question from Susan Graev. Is there a great difference between Ebola and hemorrhagic fever? Dr. Nikima? Is there a difference between Ebola and hemorrhagic fever? Over to you.
Oui, merci beaucoup. En fait, Ebola fait partie des fièvres hémorragiques. Mais Ebola n'est pas la seule fièvre hémorragique. Donc, il y en a d'autres. Et lorsque l'on connaît exactement la souche, cela facilite rapidement la réponse. Et donc, au niveau de la RDC, nous avons soutenu l'INRB pour faire, euh, pour avoir la capacité de faire le séquençage et identifier quelle fièvre hémorragique exactement est en question. Et ça, c'est déterminant pour avoir une réponse très rapide. Et c'est ce qui se passe en ce moment. L'INRB a été capable de tester rapidement les échantillons, de faire le sequencing et d'identifier que c'est Ebola Zaïre, qui est une fièvre hémorragique, qui est en question ici. Et heureusement, comme Dr Patrick l'a dit, il y a un vaccin et il y a des médicaments. Donc, ça nous met dans une position favorable pour répondre de façon appropriée et rapidement à euh, à cette épidémie.
All right.
Merci à vous.
Merci. Merci beaucoup, Dr. Nikema. We have another question. We will start with you, Dr. Patrick. This is from Lucia Blanco from Spain's International News Agency. Initially, 16 deaths were reported, but now you are talking about 15. Can you clarify? And secondly, are you worried that the recent aid cuts might jeopardize the response to the new outbreak? Maybe Dr. Patrick, then Dr. Nikema can complement. Dr. Patrick, please.
Okay, thank you very much. It's a very important question, but also in this situation, it's a fluid situation that's always changing. So I don't always want to dwell on the numbers, because the number you had 30 minutes ago may have changed in the current time, because cases are being reported and investigation is ongoing. So what we are talking about is 15 deaths out of the 28 suspected cases that have been reported. So in the last 20 minutes, if things have changed as well, so those numbers will be updated. But in the last 1 hour, what we know is that we have 28 cases, suspected cases. We have 15 deaths, unfortunately. The second question is very important. What we have learned responding to multiple of these Ebola outbreaks and other hemorrhagic fever outbreaks is that you need to get the resources at the field as early as possible so that you can be able to interrupt the transmission. So what do you need? You need the human resources that are trained. You need the supplies, infection prevention, PPE. You need to have sufficient isolation capacity where you can isolate and safely manage these cases. You need the vaccines. You need the the therapeutics to manage. And then you need the money to pay for the different operations. You will have contact tracing teams moving around, investigating, listing contacts, and following them up daily. So it's a resource-intensive operation. However, we acknowledge the fact that the recent cuts in aid will have definitely impact, but we are determined, working with the government and all the other partners, to mobilize the resources that are required to mount comprehensive response in the next coming days and ensure that this outbreak is interrupted. I also want to add upon that, as we have seen, diseases do not respect borders. So whenever we have an outbreak like this, it's our responsibility as a globe to work together to ensure that DRC is supported with all the resources that it needs to stop this transmission. Because when you have outbreak in one area, it can quickly move and reach another area. And what we do not want to see is the outbreak spreading further than where it is now. And therefore, we will give all the resources that we can and work with all the partners that are available on the ground to support the government to respond.
Thank you, Dr. Otim. Dr. Nikema, do you want to weigh in on this question?
Yeah. Thank you very much. This is a very important question. Just to remind everybody that DRC is already responding to several emergencies, Mpox, cholera, etc., and the health system is already overstretched. In this situation, in this context, it's very important that we join our voice to call for support for DRC, not let DRC alone. And this is what WHO is doing, to convene partners, to coordinate and ensure that coordinated effort is being deployed in DRC to end quickly this outbreak, and also to strengthen the system, because if the system is still very weak, the risk is there to get other outbreaks in. Thank you very much.
Thank you, Dr. Nekima. We have our next question from Zulfika Abani. And his question is, if previous recent outbreaks were contained in few days, how does this outbreak compare, given its fatality rate of more than 60%? Also, how do you account for the deaths among healthcare workers? I will start with you, Dr. Patrick. Dr. Patrick?
Thank you, Marian. And I really appreciate that question. So the outbreak has just been declared today. So we already 2 days into the response. We have teams on ground and they are responding, they are scaling up. So we are quite certain that if we get all the ingredients like we have done in the previous outbreak, so we have gotten all the response teams and resources that we need on ground, the knowledge is there, the expertise is there for us to be able to contain it in time. Now, unfortunately, for viral hemorrhagic fevers, one of the things that usually raises suspicion that you are dealing with something unusual is that you have infection amongst healthcare workers. So you have an infection or death of a healthcare worker. It's usually one of the things that triggers. Why is it so? Because most times the viral hemorrhagic fevers, like the question that was asked earlier, they present with the fever, high-grade fever, but fever is common to a number of illnesses in the tropics. So it's only at the later stage of the disease that people present with bleeding. So most times the treatment is given for malaria or for typhoid or for diarrhea, dysentery, and the disease is not picked. It's only when the index of suspicion rises when you start seeing some healthcare worker who has cared for a person dies. So in the initial phase, when the outbreak is not known that we are dealing with a viral hemorrhagic fever, the level of protection that healthcare workers use is very low. It's the basic IPC, and therefore they are exposed. So in this case, you had a midwife who was caring for the first identified case in the maternity ward. You had a laboratory technician who participated in collecting blood sample. So they are exposed, and unfortunately they died. And once this is confirmed, we now scale up the level of protection, provide them the appropriate PPE that they need to use. And our priority is really to protect the healthcare workers so that they can be able to deliver safe care to the people that are affected. So going forward, ensuring that all the protective equipment that the healthcare workers need is one of the priorities that we are working with the government on, and these have already been dispatched to the field, and then working to ensure that all the suspected cases and other contacts, the suspected cases are identified and isolated and treated, and then the contacts are followed up. Once we implement all these measures, we should be able to interrupt the transmission. But this is the starting phase of the response. We are just too early in to make an assessment, and we will be doing all that's relevant and that's required from all the experience that we have to be able to support this and ensure that we interrupt it as soon as possible.
Thank you, Dr. Utse. Now, moving over to you, Dr. Julien. How do you ensure that communities report suspected cases and comply with public health advice?
Thank you very much, Mrs. Tabi. The most important thing with the community is really to build trust. If we build trust with the communities, they will be able to really engage, report the cases, participate in the early detection at the community level. That trust is really the key aspect on which we have to focus on, which are demonstrated in the previous outbreak that focusing on trust at the earlier stage is really the key to engage community, to report cases, to go to the hospital or to the healthcare facility when they are presenting the first symptom. This trust means that we have to go and sit with them, communicate the risk, explain to them what is the disease about, the mode of transmission. Also communicate all the public measures that we have in place to contribute to save their life, like the vaccines that Dr. Nikema and Dr. Otim already explained that we have something like 2,000 vaccines. So all those deployments of material or human resources or financial and the vaccines is that we have to communicate to the community, because people they are afraid. So we have to take them to understand that we are together and they are protected, and we have measures, we have needs. All the partners are together, so supporting the government of DRC. And we communicate what is ongoing in real time. This is what will help us to build trust. And communities will come and will report. They are not going to hide people in their house. Thank you very much.
Thank you, Dr. Julian. I will now move back to you, Dr. Nikema. We have a question on the affected region. Given the remoteness of the affected region, are there risks that the outbreak goes out of hand before teams reach on the ground to start the response operations?
Yeah, I would like to recognize that the access is difficult, but we have the solutions. We know how to reach these places and contain the outbreak. And the team is already in the field to control, to support local capacity. So even if access is difficult, it's a remote area with forest, etc., difficult to reach. This is where the challenge is, and we need jointly as a partner to support the government to reach quickly this area, and it's possible, and the team is making it right now. So I don't want to give the impression that someone will prevent controlling this outbreak. It's difficult. This is why we need jointly to support the government and also increase the support because the government is investing, communities are engaged, but the support need to be provided. And from the communication, let me touch a bit on the communication aspect. In this remote area, we need to pay attention of the local languages and make sure that the tools that we have provided are translated into local languages, and also use the local the champions in the community for the communication, as mentioned by Dr. Anu, to build trust. Without trust, it will be very difficult. It will delay the response. Thank you very much.
Thank you, Dr. Nikema. Dr. Patrick, do you want to comment on this, the remoteness of the region, and if there are risks of the outbreak going out of hand?
Thank you. So the access is a very important aspect for emergency response. We need to get the teams, the supplies on the ground. And as the WR has mentioned, we have done similar responses in DRC before, and we've been able, with collaboration, to get the supplies and the teams and all that we need on ground in time and respond to control. So I am appealing that we replicate what we have done before. If it requires, for instance, opening an air bridge, deploying aircrafts that can move the teams quickly to the areas that they are needed to be, I think it's a help that will be much welcome, so that we can cut the duration that the teams are now using to move to the field. But it's something that is totally doable, and the resources are available that we can leverage from different partners and stakeholders to be able to move to respond. I would like to highlight three things. Usually when we have an outbreak declared like this and we are at the point where we are, we have three main priorities. The first priority is to save lives. So we need to stop people from dying. We need to get the treatment centers established. The clinicians who will manage the cases, and we need to move the people from the communities where they are to the treatment centers and protect the healthcare workers to deliver. Number two is then to stop the transmission. So we have the vaccines, we have the contact tracing that we need to do to identify the contacts and follow them and interrupt the transmission. And then other issues in terms of investigating where this outbreak came from and all these things will be the last priority. So the number one priority now, we need to save lives, we need to stop the people from dying, and if we can get the things that are critical to enabling to sustain them. And as I had mentioned earlier, for Ebola, you need to be able to get to the treatment center as early as possible. And you are given the supportive care that you need so that the body can be able to fight these infections. And this has to be done in a controlled setting where the healthcare workers are protected and they can be able to give you this safe care. As much as we do this as fast as possible, we can be able to save many lives. And as we move the suspected cases from the community, we are also contributing to stopping transmission because they will not be able to come in contact with the members of the family, and we will be able to stop this quite faster. Thank you.
Thank you, Dr. Otim. Still on you and speaking on vaccines, when will vaccines be deployed to the field? And do we have timelines about the start of vaccination? And do you anticipate any community resistance to vaccine?
It's a very important question. So the reason the vaccines are not in the field now as we speak is because we needed to identify which of the Ebola species are we dealing with. So now that it is identified today that we are dealing with Ebola Zaire, we are quite sure that by tomorrow we'll have the vaccines in the field. Usually for this vaccine, we want to administer them at least within the most ideal is to administer them to someone within the first 72 hours after they came in contact with a confirmed case. So we need to have them in the field, and as contacts are being identified, they can be vaccinated quite quickly. So we want to have the vaccines there as soon as possible, and the teams will be working to initiate that to happen within the next 48 hours so that we can be able to implement the vaccination.
Thank you, Dr. Julian. Do you want to complement? Do you anticipate any community resistance to vaccines?
Well, the anticipation is the approach. To anticipate, we are going to adopt this approach of trust. We are not going to we are going to use trusted people that the community trust. They will be the one on the front line. They will be front line to explain the importance of the vaccination, how the vaccination will be deployed, how the vaccination will be administered, all the strategy of the vaccination. We capacitate trusted people from the community, including their healthcare workers, who will be leading all the explanation regarding the vaccination, the vaccine strategy. We have done it before. Once we rely on local people, we rely on religious leaders, we rely on champions, trusted people by the community, we don't use to have a resistance. So anticipating means putting in place a very strong trusted relationship with the community, engaging them with their own leader, speaking to them in their own language, and engaging the campaigns, sensitization campaign, awareness campaign in their own language. I think that this is the best way for us to anticipate, and this is what we are going to work on from now to the next weeks or the next days. Thank you, and over.
Thank you, Dr. Julian Anoko. I see no further questions in our Q&A function.
If I can add just one comment
to please, Dr. Otim.
Excellent submission by Dr. Anoko. And this is not the first time we are also deploying this vaccine in in DRC. So it's a vaccine that has been used before. We have used it in 2022 in the Equateur, as well in Beni. So one of the things, usually the community, they hear about this and they know that this is something that has been used before. So it's not new. And as Julian has mentioned, in terms of the trusted people, the community engagement that needs to happen. There are also colleagues that have, people that have received the vaccine before that can be able to speak to the community so that they know that this is not something new. It has been used before and it was very, very effective in helping to stop the transmission. So in these situations like this, we do not take anything for granted. And human beings have agency. So the most important thing is that the response teams will explain what is this vaccine, what does it do, what are is there any side effect? And based on this, we are quite sure that the community will make informed decision and accept the vaccines. And that is the approach that we have been using before, and the communities have been quite welcoming, and we look forward to employ the same approach in ensuring that we reach the targeted beneficiaries for this vaccine.
Thank you so much, Dr. Otim. We are coming to an end of this virtual press conference. We will now turn over to our panelists to hear any final messages, and we will start with you, Dr. Julian Anoko. You have 1 minute, please.
Thank you very much. Community engagement is really essential for effective outbreak response, and all the means are in place to make sure that our communities, they are going to really engage in the response. They are going to receive all the support together with all the partners. We have already done it before, and we are just going to deploy this excellent strategy that have shown good results for during other outbreaks. We are going to make sure that this is in place from here to the next week, to make sure that community engagement is in place. We work with trust with the communities. We communicate with them in their own language. And the most important, we listen to them and we respond to their worries. Thank you, and over.
All right. Thank you so much, Dr. Julian. I will move over to you, Dr. Patrick, for your last final message. But as you answer this question, we got one question from a colleague, Esther Nakazi. Are there therapeutics that you are deploying to? And so, if so, which ones? Maybe if you can answer that, then go over to your final message. Dr. Oti.
Thank you. As I did mention, we have 2 therapeutics that are approved for Ebola Zaire. Those are monoclonal antibodies. The one we have in Kinshasa, we have around 100 treatment courses of the monoclonal antibody MAB114. That is the one that will be deploying to the field. And we will be working to see if we can get additional doses of the second monoclonal antibody as well, so that we have to be able to manage. But given the number of cases for the first 1 week, I think the doses that we have can be sufficient to manage, but we have to work to get additional antibodies available to manage. Now, moving on to my last words. One of the things when we are dealing with Ebola, it's a disease that evokes a lot of emotion, a lot of fear, and we want to stress that there is no need to panic. In DRC, we have very dedicated teams of resilient healthcare workers who are putting in their best, and I would like to say at this point, we have unfortunately lost 4 of them who have given their lives on the line of duty working. And what we cannot do is we cannot let them down. The global community cannot let them down. We need to provide them with the tools and the resources that they need to be able to stop this outbreak. They have done it before. They can do it with our collective support. As WHO, we also have a wealth of experience that we have accumulated over the years in controlling the different outbreaks that we have had. And we are putting all this expertise at the disposal of the DRC to be able to respond and control this outbreak. as the global community, we need to come together in the spirit of international health regulation and support DRC, encourage them because they have come out openly and declared this outbreak in a very short time. Therefore, we need to be able to extend solidarity and work with them to stop this outbreak. So to the rest of the people, it's important to always understand what the disease is about, how you can protect yourself. And we know that this disease is spread through contact with an infected person. If you are in an area, the areas that we have mentioned, there are healthcare facilities that have been designated. Report when you have any symptoms that are suggestive of Ebola, or you have come in contact with a confirmed case. For the rest of us, we need to spread the true information, the correct information that will help us all work together to stop this outbreak. So thank you very much, and we stand in solidarity with the colleagues in DRC and will continue working with them until this outbreak is contained.
Thank you so much, Dr. Otim. Now we are on to you, Dr. Nikima, for your final words, please.
Merci beaucoup à vous et aux panélistes. Juste pour redire que l'intervention, la riposte, l'action de l'OMS en République démocratique du Congo en réponse à cette épidémie est fondée sur la transparence et également sur l'efficacité et enfin sur la science qui couvre le tout. Donc, cela nous permet, dès le début de l'épidémie, de parler avec vous en toute transparence et de vous demander d'être les interlocuteurs auprès du public pour passer les bonnes informations, parce que l'accès à la bonne information est critique ici et c'est un droit humain. Parce que en connaissant comment l'épidémie se répand, comment on peut se protéger, la population peut sauver sa vie et arrêter rapidement cette épidémie et reprendre et continuer les activités. Et l'OMS est très fier de collaborer avec vous et nous sommes disponibles pour répondre à vos questions à tout moment et ensemble, nous pouvons éviter que les infodémies, les informations fausses ne prennent le dessus sur l'action salvatrice actuellement en République démocratique du Congo pour arrêter rapidement cette épidémie. Merci beaucoup.
Merci beaucoup, Dr. Nikima. And thank you very much, dear panelists, for all the information shared today. Thank you to everyone who participated, and see you at the next press briefing. Bye-bye.
Thank you. Bye-bye.
Thank you very much. Bye-bye.